Our teams are seeing a number of people presenting with children with Omicron or Covid-19. I think that's a range of different types of presentations, but most children who are presenting currently are only mildly unwell, and there's a lot of people worried about how to get a test or other elements of that. But of course, there's some children who are requiring admission either for COVID or because of other problems, and they happen to have COVID as well. Yeah, so let's, just to be clear, Omicron in children is typically a very mild illness. And so what we're seeing is children with a fever, a runny nose, sometimes a bit off their food or drink. So those are the typical symptoms, and I think people will be familiar with those. Those are common, kind of childhood illness, viral infection symptoms. And so, we're hoping that people are aware of those and can manage those sorts of things at home. So there is some gastro-type involvement with Omicron we're seeing in kids. So kids might get some tummy pain, they might get some vomiting and diarrhea, or just they may just be off their food and drink a little bit. And again, those are things that we would hope that people can manage at home with keeping kids' fluids up. As long as they're having half their normal fluids or thereabouts, then we're usually pretty comfortable for people to manage at home. And similarly, if they have some pain, they might have muscle aches or tummy ache, that sort of thing, then simple paracetamol or ibuprofen is usually effective for those things. I think there's kind of a spectrum of care available to people. I think we're hoping that people in the first instance, they might go online, they might look at something like Kids Health, get some information, or call Healthline, or talk to their GP. Those sorts of things can be pretty reassuring. But the things to really look out for are if kids are having less than half their normal amount of fluids, if they're having breathing difficulties, if they're very, very tired and lethargic, or if they've just got worsening pain or symptoms that aren't being resolved with paracetamol and or ibuprofen. I think it's about kids really breathing fast or sucking in around their ribs, looking like they're working hard with their breathing. So sort of like they're going for a run, even though they're not, obviously. And so we're seeing that very infrequently, to be clear, but I think if people see those things, then again, talk to Healthline, talk to the GP. Obviously, if you're very worried, then they can call 111. We've seen a really significant rise in children and young people presenting over the last week or two. I think what we're seeing is almost all of those children are able to be discharged home. And so I guess what we're saying to people is, be aware of the symptoms that are typical with COVID, but seek help if they go beyond that, as per the things we just talked through. I think the first thing is, that's right. I think we think that COVID is something that many people are going to experience with their children. I think that we're expecting this to be a mild illness in the vast majority of children. We want people to use their online resources, so things like Kids Health. We want people to talk to Healthline or their GP if they're worried about the symptoms. We're expecting most kids to have just mild kind of cold symptoms and a fever. But if things are getting worse, if kids are having trouble with their breathing, if they're not drinking more than half their normal fluids, or they seem very lethargic or in pain, then obviously we want them to seek more help, either through their GP or by calling 111 or coming to an emergency department.